In this lecture, we will discuss the anatomy of the left ventricle and its vascular supply. It's important to be mindful of the anatomy of the left ventricle and its vascular supply. This is because the left ventricle is pretty much always involved in any acute myocardial infarction. When providing the location of the myocardial infarction, it is being made in reference to the left ventricle. The left ventricle is pretty much in the shape of a bullet, okay? So if you look here, we have our left ventricle. So here's one depiction of it. This would be our right ventricle, okay? And then our left ventricle is depicted here. Notice it has that bullet shaped, okay? You can imagine it sitting in somewhere in this region here, okay? So it has that bullet shape, and what we have along its long axis is that it can be divided into three main parts. It has the basal, it has the mid portion, as well as the apical part, okay? So this is the basal portion, okay? Imagine that here. Then we have the mid portion here in the apical, okay? So mid and apical there, okay? So again, this is all the left ventricle that we're talking about. Now the left ventricle can also be subdivided into four walls. It has an inferior wall, the anterior wall, the lateral wall, and the septal wall, okay? So again, the septal region would be here, okay? As you see here, this is pretty much the anteroseptal. The anterior portion would be here on top, okay? So this is the anterior, so anterior, septal, okay? Imagine that you have the right ventricle sitting right here, okay? So the septum lying in between, okay? Same thing here. Here's our right ventricle, the septal region there. Then you have the posterior wall of the heart, okay, as well as the inferior, okay? So four parts or of the four walls of the left ventricle. So when we say there's an anterior MI, we're suggesting that there's an infarct in the region of the anterior wall of the left ventricle. And when we say there's an inferior MI, we're suggesting that the inferior wall of the left ventricle is infarcted. And the same holds true for the lateral and septal parts, okay? Hopefully this is making sense. Now these left ventricular walls are supplied by different coronary arteries. The anteroseptal and anterosuperior walls are supplied by the left anterior descending coronary artery, or LAD. The posterolateral wall is supplied by the left circumflex coronary artery, and the inferior wall is supplied by the right coronary artery via the PDA, or posterior descending artery. That is in the common right dominant system that we're talking about, okay? So again, let's just look at this anatomy here. So again, here's our RCA, our right coronary artery. Our left main coronary artery gives rise to our LAD, left anterior descending artery, and the left circumflex, okay? And we're talking about here that, let me just erase some of this stuff so you can see this. So again, we have our anteroseptal wall supplied by the LAD. You can see it's in red. Anterior superior wall, again, also supplied by the LAD, which is this portion here, running over the anterior portion of the wall. Notice our septals that are innervating that septal portion of the ventricle, okay? And then we have our left circumflex over here supplying our posterolateral wall, okay? Notice how it's coming here to the left side, that lateral wall. And then we have our right coronary artery, okay? That's supplying the inferior wall, and this is in those right dominant patients. So our right coronary artery comes back through our PDA, supplying that inferior wall, okay? So it's the RCA supplying the left ventricle via the PDA, okay? Hopefully that the coronary artery anatomy is starting to come together, okay? Now ischemia typically starts in the subendocardium of the left ventricle, and from there it spreads to the epicardium. Purkinje fibers are actually able to survive ischemia, which may be because they run through the endocardium, okay? So they're able to get some of that oxygen from that phase. So ischemia in this case goes from our endocardium to the epicardium, okay? Notice we have subendocardial ischemia involving this portion, the subendocardial layer of the left ventricle. So this is our left ventricle. And transmural, that's when we have the full thickness ischemia. Notice the whole thickness of this is involved. And what we have spreading, imagine if that subendocardial ischemia proceeded, it would come outwards, okay? So we're going from endocardium to epicardium is the direction of ischemia in the left ventricle. All right, let's review what we discussed before we end here. So again, the left ventricle, why we want to know its anatomy is because it's involved in pretty much any acute MI, okay? It has that bullet shape that we talked about. We talked about in the long axis, which is this area here, has the basal, the mid, and the apical portions, okay? The walls in the vascular supply we also discussed, where the LAD, the left anterior descending artery, this one here, is supplying the anterosuperior and anteroseptal, okay? The anterior and septal portions of the left ventricle. The RCA, the right coronary artery, this one here, comes around to our PDA, supplying the inferior wall of the left ventricle. The left circumflex, the one here, coming off the left main coronary artery, supplies here that posterolateral wall, okay, of the left ventricle. And then we also mentioned that ischemia of the left ventricle proceeds from the subendocardium to the epicardial layer of the left ventricle. Well, that's the end of this lecture. We discussed the anatomy of the left ventricle and its vascular supply. I hope you learned something.